You can go ahead, sir. Thank you.
Honorable Senators, committee members, thank you for listening to me today. My name is Paul Barrows. I'm a retired federal law enforcement officer with 28 years civil service. I'd like to bring your attention to a critical gap in our state's mental health care system and urge you to take action. I would like to share the story of my son, Cody Barrows. Cody, now 32, was once a promising young man with a bright future ahead of him. He attended Flower Mound Marcus High School, graduating in 2011. His academic and athletic achievements earned him a partial scholarship to play soccer at Austin College in Sherman, Texas. However, several months into his first semester, Cody was diagnosed with bipolar disorder and placed on meds. Cody maintained that he wasn't sick, and he didn't have the disease the doctors told him that he had. His condition progressively worsened due to inconsistent medication adherence, and in 2014, his diagnosis was updated to schizoaffective disorder with mild paranoia and co-occurring disorder of anosognosia. I would highly recommend and encourage you, if you don't know why people don't take their medication, they could be suffering from anosognosia. They don't know the lack of insight into their condition. They just don't believe they're sick. My son told me, "Dad, why would I take this medicine? I'm not sick." It's been a persistent challenge in Cody's treatment. In years since his diagnosis, there's been a heartbreaking illustration in the gaps in our mental health system. He's been arrested 15 times with more than 30 encounters with law enforcement. Cycling through the criminal justice system, which is ill-equipped to address his mental health care needs. He needed long-term civil commitment to where he could be in a hospital in a setting where he could live with dignity and purpose and participate in classes, art classes, therapy, go outside, get sun, exercise. But those aren't available. Instead, he's been in several hospitals where they over-medicate him and he shuffles his feet down the hallways.
Sir, I know you're out of time, but what are you asking? What are you asking? I want you to be able to complete your thought, because I think this is not necessarily an unusual story, as those of us who have seen people processed through the jail and talked to parents. I was a judge once, and I had parents like you in front of me, and there just wasn't a lot of help to offer. So what are you asking for?
So people like Cody who suffer from anosognosia, where they don't think they're sick, they don't stay on their meds, they cycle through, they criminalize their mental health. So there needs to be a safer option, because he's a public safety threat. He's going to be released on Thursday after his felony was reduced to a misdemeanor because they didn't want to go through civil commitment. So he's about to be released. And as much as I'd say I'd love to have him on the outside, he needs a safe option,
Right.
campus-style setting, hospitalization, it's still secure, but where our most vulnerable can live with dignity and purpose still, even while, in a secure facility. Thank you.
All right.